Okay, so it's 12 o'clock, so I'm going to go ahead and get started. For those of you who don't know me, my name is Keith Merrick, and I guess I am now in charge of the Economic Development Committee. So Randy, thank you for handing off the reins. I'll figure out what the heck I'm doing. Basically, we had a couple of things I wanted to talk about today. But first of all, I don't honestly probably know everybody on this. So can we just quickly go around and reintroduce ourselves, and I'll start. Again, my name is Keith Merrick. I'm a financial advisor with Edward Jones. And I guess I am now the vice president of the chamber. So I get to follow in Randy's footsteps. So I guess I see Sally next. Sally, you want to jump in?
Sure. Thanks, Keith. Aloha, I'm Sally Inchetta. I've been a member of the chamber for about 7 years. I'm with the Hawaii Public Health Institute and in a new role as the East Hawaii Drug-Free Coalition Coordinator. Mahalo.
Awesome. And Lisa?
Hi, I'm Lisa Rantz, a chamber member and also part of the Access to Care project that you're going to hear from us today about. I'm Executive Director for Hilo Medical Center Foundation and President for Hawaii State Rural Health Association.
Awesome. And Kim?
Hi, everybody. Kim Kobayashi with Community First. I'm a program manager there, supporting the Access to Care project and also on the Hawaii Island Rural Health Association board. Thanks.
Great. Keola, you want to go next?
Sure. Aloha, I'm Keola Ma'ahiwet, and I am a new chamber member. Not even a year yet, I guess it's been. And I'm the career liaison here at Kamehameha Schools in Kea'au. And thank you for all the work that you all do. Aloha.
All right. Randy, I got you next on the screen.
Hey, how's it, everybody? First off, I'm David's brother. I see David there. Sometimes you get mixed up, but just to make it clear, I'm his older brother. Yeah, and so I've been a chamber member for many years. I have a couple of businesses, and also I'm working with a nonprofit as well now. But yeah, so we'll be doing our presentation shortly.
Great. And Judy?
Hi, I'm Judy Mellon with Small Business Development Center. I'm a business advisor there, been there a long time.
Awesome.
Thank you.
Mary, you're up.
Hi, everybody. My name is Mary Berger. I've been a member of the chamber since the 90s, and I've served in lots of different positions at the chamber. I really love the work it does, and just wanted to support Keith in his chairmanship.
Thank you. Jeff?
Awesome.
Hello, everybody. I'm Jeff Deason. I run Success Group Mortgage and Servicing here in the island. I've been here about 2 years. Prior to that, I worked in business and economic development in Michigan and was CEO of approximately 600 member Chamber of Commerce and sat on a lot of economic development committees there. So this is of particular interest to me.
Great. Thank you. Justin?
Yeah, hi, my name is Justin Clayton. I'm with Central Pacific Bank, senior business banker based in the Hilo branch. I've been a member for, gosh, maybe 10 months now. So I'm enjoying it, and I appreciate everything you guys do.
Great. Welcome, Justin. Maria?
Hi, my name is Maria Vicente. I work with the Hilo Center for Community Engagement. I'm attending this meeting for my boss, Julie Maurer, so that we can kind of learn more. But yeah, happy to be here.
Great. And David, you want to tell us what you do besides catch mullet?
Yeah, I also work full time. I work job, so I don't only fish. I'm Randy's brother. That's another fact. And I've been with Hawaiian Electric for 21 years. And yeah, I like being on the Economic Development Committee. I think I've been on this EDC committee for like 18 years or something, some crazy number. Anyway, welcome, Keith.
Okay, thanks, David. Dennis?
Hey Keith, Dennis Lin with HPM Building Supply. I'm the Community Relations Administrator, and I've been a member of the Chamber for 8 years. And I'm also the co-chair of the Young Professionals Committee. I like to join in the EDC meetings more often, so I'll be popping by when my schedule allows. Thank you.
Okay. And Ben?
Hey, Benjamin Mark, Pico Arts. I do freelance management, marketing, and bookkeeping work. I've been a chamber member since I moved to town about 3 years ago. They just tricked me into being on the board, so I have that title this year as well. In past life, I did lots of community and downtown redevelopment. So this committee really kind of fits in that mold there too. Excited to be here.
Awesome. And then Warren, I know I see your name up there. I can't see your face, but.
Oh, here you go. Warren Lee. Aloha.
Hey,
with Honua Ola. And thank you for having the presentation, Keith. Very interested in what's going to be presented this afternoon. Aloha to everyone.
All right, cool. Jackie, I saw you just came on. We're just introducing ourselves briefly, so I get to let you do that before we get started.
Aloha, Jackie Hoover, Hawaii Island Economic Development Board, Hawaii Leeward Planning Conference, and privileged to also be a member of this committee. Mahalo, Keith.
Thank you. And thank you guys all for coming today. I think I did get an email from Glenn Kagimita, and I thought what he had to say was very interesting, and I think it's something that we can think about doing this year, which is basically trying to figure out, and I would like all of you guys to think about this, and maybe we can talk about it at the next meeting, or you can email me some ideas, basically what we can do to help move the business community forward, right? We've been kind of in lockdown for a couple of years, and we're starting to open up again in terms of how can we push, or what can we push our state and county representatives to do that will help us business-wise, right? Because I'm just thinking about certain things that they've done recently that don't necessarily help business, like raising minimum wage. I was listening to NPR the other day. They were talking to someone from HSTA, and they were talking about why they were supporting someone instead of Ed Case. And one of the major things they said is because he's pro-business. And I have a real problem with that, because I try to think that where does their tax dollar come from that actually pays for all their salaries, which I guess it's magic, but you know, that was their reasoning to not support Ed Case. So certainly need to get more done. And so the idea, I guess, would be is, what do you guys think that we could help push forward to help our businesses succeed on this island, and I guess across the state? And maybe you guys can just email me some ideas, and we can maybe focus on that, and then try to get some of our elected officials in here on a meeting and ask them about that and see what they can do to help us, because, well, guess what? They're all trying to get reelected this year, so they'll probably be very willing to talk to us. So, so anyway, that's kind of what I'm looking for. Mike Miyahira also gave me Bauman. I don't even know how to say that. Sadegi, I guess, who purchased Metal Gold a few years ago, and he was suggesting we listen to him and talk story about what that business is doing. So I'm always open to that idea too, but I do like Glenn's idea of maybe being a little more focused this year in terms of, hey, what do we want to accomplish and how can we push that forward? So that being said, we have asked Randy and Kim and Lisa today to come and talk to us about the Access to Care, which is the comprehensive health needs survey that they did. And I believe you guys might have some results, or I actually don't even know what you're going to talk about today, but the floor is yours. So please enlighten us.
Yeah, thanks, Keith. So if I could ask Kim to share, if we could get our slides up. So, you know, while she's loading, just quick, you know, a little bit about our organization. Kim, we can go to the next slide, please. So, is there a way that you can share it bigger, or does that look okay to everybody?
Looks good to me.
Okay, so anyways, the role that we play is basically we're like a convener. We bring our healthcare and social service providers together along with our government leadership, you know, policymakers and other stakeholders, and we really try to tackle challenges and opportunities in healthcare that can probably only be solved by working together. So these are some of the more critical or bigger challenges that we see out there. What we did with the access to care is really the goal of this project, which is on this slide, is really to better understand what Hawaii needs to improve timely access to healthcare services, right? So, you know, one of our other, you know, goals is to really see what we can do to keep as much healthcare local as possible. But we're starting it off with a survey. So next slide. So at the end of last year, it started in the month of November, I believe, is when we actually went out and did the surveys, the majority of the surveys. And what we did was, it was mainly an online survey. We promoted it well through a lot of different media platforms to make sure that as many people on Hawaii Island could take this survey, which was very, very successful. We got like 2,000 people to actually fill out the survey, and it was both a survey for people in the community, but as well as our providers to take as well. So there was a different set of questions for the providers, but that way we could get as far as the results and findings from both groups. We also combined that with focus groups that we conducted throughout those months as well. And we wanted to make sure that we were able to collect data or surveys from all districts on this island, and making sure that we, in particular, paid very good attention to some of our racially, you know, ethnic groups that perhaps are a little harder to reach, and some of the geographic areas on this island that are a little harder to reach as well. So we actually went out to those districts, showed up at a lot of different events, stood outside of supermarkets and places where a lot of people gather, and administered surveys in writing as well, whichever was best for the people who wanted to fill them out. So again, we went out of our way to make sure that we could reach and hear the voices of the people in, you know, from around the island. So again, that was towards at the end of last year, and basically we also used Hawaii Island as sort of like a pilot for doing a survey for the rest of the state, which we just got done in April. We went out and used Hawaii Island's model as a way to reach the rest of the state. And we did very well as far as getting a lot of results from that as well. But basically we were able to add a few more questions. So again, we've got an additional 400 something surveys for Hawaii Island that came in the second round. And I think that's about it. And then I'm going to turn it over to Lisa so she can kind of go over the findings from our surveys.
Randy, I did want to add that we also reached out to the houseless population as well, did a couple of surveys too, which was, I think we got about 23 of those, so that was very helpful.
Yeah, thank you, Randy. We tried to be as comprehensive as possible. The next slide shows our partners that we engaged with on Hawaii Island, and then we added partners as we moved statewide, and we're going to keep hinting at that because on July 26th, we would love for you to come to that webinar and get the statewide results and invite those folks that you know would benefit from hearing hearing about that. So on the next couple slides, so we're going to go ahead and move forward to the next slide. They're dense in wording, and then we're going to get into some more graphs and things like that. So I'll try not to read from these slides, but basically economic insecurity is the theme throughout. And I know that we're experiencing that just, you know, with small businesses and large businesses as well. But, you know, worrisome number of our respondents on both sides, both on the provider survey and in the community survey, had to cut back on groceries and or medical care. And in 2 slides, you can see some numbers for that. But then we were also seeing a theme with mental wellness and folks feeling like them or a close family member were in crisis or experiencing a mental health issue. And so, yeah, that's something that we definitely need to start taking a look at as we move forward. Even pre-pandemic, Hawaii Island had the most severe mental and behavioral health shortages and the highest suicide rate and behavioral health support rate in the state. So this is lining up with the things that we've been hearing anecdotally. And that was one of the reasons why we felt it was so important to pull all of this information together in one project, which, you know, we're calling Access to Care. And then on the flip side of these surveys, this is the qualitative data, if you will, and then we're getting quantitative data from HMSA, who's sharing with us the amount of services being flown off island by procedure code. And then we'll be able to say, here is where we need to recruit, here's where our shortages are, here's where we might be able to bring in providers from Oahu to fill the gaps, or how we can leverage the resources that we have on island to provide more access to our community members, which is really what we all deserve, right? And as you know, COVID-19 has made everything a little bit worse. And we'll go ahead to the next slide, because we've got some numbers to show you after this particular slide. And so access to care, physician shortage and healthcare costs rose to the top. In the survey results, there are some pretty significant delays when trying to get in to see a primary care doctor, and even worse when you go to see specialists. And I have charts on that, so I'll just kind of brush over this slightly so that we can get you to those graphics. And then just as a side note, there's been an increase in Medicaid or Quest enrollment during the pandemic at the rate of 30% more, or 100,000 more individuals, which is the highest that it's ever been in our state. And as more people go back to getting care in person during the pandemic, many people put off getting their routine health screenings, you know, their blood drawn, mammograms, colonoscopies, all of those types of things. And now that they're going back for services, we're seeing an impact at the hospital. We're over capacity at the hospital. Last week, I think we were 3 people over the amount of beds that we had available. And it's not due to COVID. It is due to people just with chronic conditions not getting care during the pandemic, and just experiencing more health issues and more severe health issues. And we're seeing that as a theme throughout the state, not just on Hawaii Island. There are good news, right? So we always tried to focus on the bright spots, and we're looking at forming some systems of care with this. But 15% of our Hawaii Island residents are interested in a health career. So that's a bonus. So we're gonna be working on that a little bit as well. We'll go ahead to the next slide, Kim. So as promised, some numbers, and then we'll get in some charts after this, but this goes to those COVID questions that we asked. 52% of folks said they had to cut back on food and groceries this past year for financial reasons. We also realized that it wasn't just the supply chain shortages due to COVID, but now it's with the war in the Ukraine and with Russia oil and just all of the costs escalating, everything is more expensive. And so 39% cut back on medical care, and 4 in 10 people say their financial well-being post-pandemic is worse than it was prior, and 25% report that they're themselves. That's a quarter of our population saying that themselves or someone close to them is experiencing depression, anxiety, needing some sort of support just to go through daily life chores and things like that. And so the next slide, please. And so here's some quotes that some of our community members put forward. We did have a space at the bottom of the survey where folks could let us know anything else they wanted us to know. And some of these get really disturbing and are very sad and poignant. We had people actually put in diary style, very long stories about what they're experiencing. And so we're looking forward to sharing this in greater detail on the 26th with a broader audience. Yeah, this would be, employees saying it was difficult to work during COVID, mental health care is impossible to access, and just, about the shortages and, the increase in substance use and those types of things. So I won't read those out loud to you, but we can go on to the next slide. And so physician shortages can worsen as our needs get greater. So here you can see that almost 60% of people, 57% are behind in their routine appointments, as we mentioned in the previous slide. 37% of respondents self-report that their physical health is worse now than it was before the outbreak of the pandemic. 76% of folks, it's their perception that accessing care is the biggest barrier, not being able to get in to see a provider, our biggest struggle. And the bottom there, about about a quarter of our Hawaii Island residents are contemplating a move either to the mainland or to another island due to health concerns. Next slide. And then on the provider side, 49% of our providers surveyed are considering reducing their hours. 40% are considering leaving medicine altogether, whether that's a retirement or career change, and 44% are considering moving to the mainland. So with the shortages that we already have in existence, if half of them decided to leave tomorrow, we would be in a real difficult situation. And so what we're planning to do, because this isn't just a one and done, our philosophy on this is that the time for studying this is over. We've been studying it for more than 2 decades, and the shortages continue to increase. So we want to pull together resources. We want to form some work groups and identify solutions so that we can fix this so that it doesn't reflect these huge shortages any longer. So we'll definitely talk more about that. Next slide. And so on this particular slide here, this was from community members providing suggestions on ways that would be beneficial for them to be able to access their physicians so that they don't have to take time off work, because that's very difficult having to find daycare. So if they could, providers' offices could be more flexible and have office hours on evenings or weekends, and then having paid time off for medical appointments to be able to travel to see their primary care physicians. So, that's what community members are saying. And we have reported this out to providers. And then obviously, we've been talking with different groups at the various chambers across the state about flexibility with staff time to be able to see a provider. The next slide. And then we have some more respondent quotes here that sort of go to what the data was on the last slide. The nearest provider is an hour away, so they need 3 to 4 hours of childcare or 3 to 4 hours off work just to go to one appointment. So by the time you get to the appointment, you get checked in, it takes about an hour if they're not behind, and then the hour back. And the person here on the response at the top, you know, trying to call to find a primary care provider, and you know, almost 10 offices said that they weren't taking new patients, even though HMSA is saying that they are accepting new patients. And this is right in line with the wait times that we're seeing, and we do have some graphics coming up on that. But people wait 6 to 8 weeks even for cancer treatment and diagnosis, and that is leading to poorer outcomes and people that actually die on neighbor islands, things that they wouldn't die of in other places. And so we're really trying to take control of what that looks like for our future on Hawaii Island and the other neighbor islands as well. And so this, I know 4 physicians who've departed Hilo alone and now need to travel from Hilo to South Kona for dermatology. So we all experience these shortages if we get care at all, I'm sure. So we go on to the next slide. And then this is taking a look at, from both the community side and the provider side, the most difficult referral or to get appointments with are for psychiatry and mental health counseling. And there is a long wish list of various specialists that they would like to see on island, you know, from nephrology and rheumatology. Since we don't have either one of those, cardiology is expanding, the cancer center is expanding, but you know, we really need more social service capacity. We need more specialists. It's just across the board. And so in being able to review this HMSA data, we can really pinpoint what's being flown off island and what we can realistically capture. Because if you look at the annual Hawaii physician shortage report, they always like to put on there that, you know, Hawaii Island has 100% shortage of neonatal neurology. Well, how many neonates are born every year on Hawaii Island that need neurological care, right? We really want to look at what's being flown off island and what is a realistic thing to say we have this shortage. And so we therefore need to recruit for this. And then HMSA can put their recruiting dollars towards recruiting that particular type of provider or specialist, because then it would be supported by our community, right? Because we're never going to have enough need for a neonatal neurologist, right? So they're probably always going to have to fly over to Oahu, to Kapiolani for that. So just being smarter at how we recruit. And the next slide. And so the next steps are creating the working groups that I mentioned a little bit earlier. And so we've got pipeline activities that are already taking place through the Area Health Education Center, recruiting students into health careers. We're going to be working with the university to connect with employers in healthcare, to really be able to reach back in the pipeline to help with matriculation and folks attending our colleges. But then once they attend the college, to be employable with our healthcare providers on Hawaii Island. So just strengthening that pipeline, and then working more on the loan repayment, because providers are coming out of residency and medical school $250,000 to $500,000 in debt. And how can you afford to pay that payment and pay rent or have a house, raise a family? It's almost impossible to do that, especially with our higher cost of living in Hawaii. So we need a more comprehensive loan repayment or loan forgiveness program in our state, because we also have the lowest reimbursement rates in the nation. So they can go to work on the mainland and make more money and things cost less. And so why would they want to be here when there's so many obstacles? So we want to be able to have our keiki come back and live here on Hawaii Island. And then, you know, we're looking at forming some systems of care as far as how can we leverage our resources and work together to take care of our populations. So we're working on different things like preceptor tax credit and just really identifying where those deficiencies are. So you may hear a little bit more about the work groups as we move forward with forming those and what that might look like. Next slide. And yeah, so we're happy to answer questions. And I know Kim has a slide for the invitation for the 26th, but we can definitely get that emailed to you, Keith, and you can share it with your committee.
All right, cool. I do actually have a question. You know, you had talked about identifying the area of greatest need. Is there anything the Big Island is doing well right now?
Yes. Do you want to stop sharing screen so we can see everybody? So Hawaii Island, we have great relationships and we have a wonderful community and they're actually very gracious. And if you talk to our providers, they work very hard to take care of folks. And Randy can also talk to this with just identifying, like, for example, you know, the issue with the surgery center. And as things start to evolve and change and procedures are done differently, how can we work together to leverage resources so that we keep the services that we need in our community, right? So it's helping to form that process and the levels of collaboration, because you can't do it alone, right? It takes that village approach.
Sally, I see you had your hand raised. Did you have a question?
Yeah, I did. I love this feedback, Lisa and Kim and the whole team. And being, you know, former president of Hawaii Island Rural Health, I really do appreciate the time to look at not just the physical health side of access to care, but also the social determinants of health. So one of the things is I'm on a new task force with Dr. Kimo Alameda, and it's called the Fentanyl Task Force. And it's just something he put together in the last few months. But we're really looking at, and I like that last bullet point you had about prevention, that it takes a village to prevent. So we see a huge increase of substance use and misuse, and it's going down to elementary age level, you know, and just having our eyes on that we provide those resources, you know, as a community for our families to, yes, get services when they identify that they want, you know, mental health services, but really get to the root causes before we get to the place where people are suffering from mental health issues. But knowing that they're abusing substances as young as 8 years old with drinking, and that age with vaping, that they're treating something and they're having access to things. So just as a hui to keep our eyes on that.
Absolutely. Good point, Sally.
Randy, I see you're unmuted. Did you want to add something to what someone?
Yeah, you know, and that's kind of what the survey sort of alludes to, is that, you know, while we can definitely in the short run, you know, look at ways that we can improve the system side of care, there is also the upstream approach, which is really the most important one. And that is getting people to take more responsibility for their own health, right? And that's through education, literacy, you know, and just getting more people in our community involved and actually concerned about what's going on.
Well said. Jackie, you got your hand up.
Aloha, thank you. So this is coming from the economic perspective, and some of you, and I know Randy's serving on our committee, we're in the process of updating the comprehensive economic development strategy, which provides access to federal funds if we can get some of these data points into the SEDS, which we're finalizing as we speak. So Lisa, Randy, Kim, would it be okay to contact you guys separately to get some of these data points into that SEDS report? And from there, we can get some assistance for some of, I see just a number of continuing surveys and policy changes that you all are going to be looking for that probably you could use some resources for. And as healthcare and access is one of the big areas that the Economic Development Administration is looking at, this might be an opportunity for us.
Absolutely. That'd be great, Jackie.
All right. Did anybody have other questions?
Yeah, so I could share, Keith, just like a little bit more about like what is working well, because I know sometimes when you look at these reports, it looks so grim. But I do know, I mean, so the landscape in healthcare has changed, right? And we do know that there's more, of our newer doctors seeking, being a doctor as more of an employment versus having their own, practice. And that's a trend that's been going on for, it's been going on for a while now. So while we see a shrinking amount of independent, physicians, I know that at least at Hilo Medical Center, they've done a really good job at trying to employ more doctors, right? Because again, if you cannot attract them to set up their own practice here, by having the hospital be able to employ more specialists is one way that we can keep a lot of these services on island or even grow some of the services. So that's, I think, a bright spot. But at the same time, I do know that there's a lot of attention being given to ways that we can make it more attractive for the independent doctor.
Yeah, part of that was getting the health profession shortage area designation, or the HPSA, for Hawaii County. And when we were able to do that, it provided for loan repayment, and it also allows for rural health clinic development. And so that's where you're seeing all of the rural health clinics that have popped up under Hilo Medical Center, and they're attached to the critical access hospital in Ka'u. And by attaching your rural health clinics to a critical access hospital, you get triple the reimbursement rate. And so they do a true up at the end, Medicare, so that you don't lose money. So they don't make money, but they don't lose money. And so that makes it a much more sustainable model to be able to provide that care. And that is why Hilo Medical Center has been able to hire the specialists and the family medicine residents that are coming out of the residency program. So, working on some of the infrastructure pieces has been a really big piece in this puzzle to navigate the shifting landscape that we're in right now.
So Lisa, I have a private doctor. So, but I'm wondering, so is the hospital with these rural healthcare centers, are you guys pushing more to like a type of, well, I guess what would we call it? The Kaiser type idea where there's multiple doctors, but you're not necessarily tied to one particular doctor. You come in and whoever's there will help you type thing?
So I think there's only a certain amount of doctors at that practice or at that particular rural health clinic. So I don't think there'll be a lot of turnover with that. And then the rural health clinics are really geared not so much toward the commercial patient, although commercial patients are welcome, but it's really to meet the gap for the Medicaid and the Medicare population, because the solo physicians can only take so many of them because of the reimbursement rate. And so economically, they can't just open their doors. And then with more chronic conditions, it's difficult for them to manage because they don't have behavioral health or dietitians and social workers and things like that, where they do at the rural health clinics with that model created by the federal government. They have to do that.
So that's interesting. So it's just because they're part of that rural healthcare clinic, that's why I get triple reimbursement. Whereas if I got a regular physician in their office and they accept Medicaid, Medicare, they're losing money?
Yes.
Oh, that's really good. Okay.
Yeah. And yeah, so, and that's because they're connected to the critical access hospital. Mm-hmm. If an independent group wanted to set up a rural health clinic, they could, but the way that they've done the formula, they would lose money. So we're working with the congressional delegation, and this is getting really deep into the weeds, but we need a different formula. We shouldn't be on par with Guam. We need to be more on par with San Francisco, which is, you know, all part of Region 9 under the Healthcare Services Administration. So just being able to show that it is more costly to provide services or to have a business in Hawaii, which seems ridiculous that you have to prove that. And then when we talk with the independent physicians to get their costs, they can't give us the costs because they've signed contracts with the insurance companies that they won't say what their reimbursements are because they negotiate all these contracts. So, you know, as you start to maneuver, then you start to figure it out, right? Because going into it, I'm just an advocate, right? I'm not a clinician, and it's just good for our communities. So then as I go down these rabbit holes, I'm like, oh, now I understand. So now what I've asked the Center for Medicare, CMS, right, is give me those 5 data points. What are those numbers that you need? And we can have the physicians' offices work with their accountants and pull those line items out for those 5 services or those 5 line items and report it in aggregate and say, here's the cost of those data points that show that it's more expensive to provide care here. So they're working on getting me those.
So Lisa, I have a question for you and Randy and Kim, then looking at this data and looking at where physicians are wanting to set up practice, meaning that private care doctor, like instead of having a practice where you have patients come into, do you see a trend leaving, and will the insurance companies follow if our doctors become concierge doctors because they don't want to have that issue of not being reimbursed and stuff? And they choose who their patients are more, you know?
Yeah, and I think, you know, concierge medicine, most of our community members can't afford it, right? You can't afford to, you know, to pay that cost. And then you still need to have insurance on top of it, because if you have any sort of trauma care or need to go to the hospital, you know, you get, you know, a serious illness, that's not going to be covered. So you have to have insurance regardless. And we have seen a trend with providers, because we don't just have physician shortages. We've got shortages of nurses. We've got shortages of physician assistants. And so if our legislature thinks that, okay, well, you know, a nurse practitioner can take care of primary care, you don't need a physician. Well, we've got shortages there too. So that doesn't solve the issue. And then what we're starting to see is they're providing telehealth or telemedicine, right, to mainland patients, because with, you know, big telehealth companies, because they get a higher reimbursement rate. So a good example of that is Dr. Michelle Mitchell. She was my private physician, my primary care physician. More and more, she was providing care to mainland patients via telehealth than she was to her patients in Hilo. And basically, she was doing that to support her primary care habit, is what she would say, because she had to do it to stay in business. And it became untenable, right? It got to the point to where she wanted to be closer to her family, and, you know, her brother had 2 little kids now, and they came to visit, and she's like, why am I doing this? Right? I love it here and I love my patients, but I'm struggling. It's not good for me. And, you know, she closed up shop. And we're seeing there's 2 physician assistants on Maui that provide care exclusively via telehealth to mainland patients. They don't care for a single Hawaii-based patient, but they're on our registers because they have a license in the state of Hawaii. And so we have to go through and we have to scrub those lists. So we're in the process of doing that right now. We have interns from the medical school over summer that call all the doctor's offices, and we find out if they're providing care here, if they're providing primary care. And so we're in the middle of doing that annual research right now. But yeah, it's convoluted. It's there's no easy fix or silver bullet, but yeah, Jackie, you see you have your hand up. I can talk forever.
Oh, no, Lisa, this is all interesting. But my question is for both you and Randy, the connection between bad dental care and healthcare is such a short line. I'm wondering if dental care, and not that you need anything else to do, but if the dental sector is integrated into the studies you're doing.
Yeah, the providers were invited to fill out the survey. And then on the bright side, the legislature did bring back oral health benefits for adults on Medicaid.
And it's probably kids that we need care for. Thank you.
I can share, like you probably notice if you have a primary care provider that's sort of a, like a solo shop, but you'll probably be seeing more and more of them sort of, like consolidating where they're, instead of just one doctor, there's 2 or 3 doctors at a practice. And that again is just a trend that's, mainly because that's how they can survive, and they need to, spread out cost of the back end side of their business over more patients. So my brother's a family provider, but he has, another doctor that practices with him, as well as a advanced practice nurse, as well. So, and I think when you look around town, you'll see more and more practices being set up that way. It's just a trend that's happening. There's also a lot of mergers still going on. So we're looking at what we're seeing with our FQHCs on the island. So you have West Hawaii Community Health Center and the Bay Clinic just merged, right? So again, it's, it's strategic in a sense, but it's also a way to be more efficient, and I think just for survival's sake, be able to serve more people in a more, efficient manner.
Yeah, and some of that is due to changes at the federal level, as far as them pushing to the insurance companies that they want to collect certain data, right? Like, we want all of your patients over 40 to have a mammogram, over 50, they have to have their colonoscopies, they have to have their blood pressure checked and blood work done. And so they have all these quality measures that were instituted from the federal level, and the insurance companies push that to the doctors. So the doctors have a lot more reporting requirements than they ever did before. And they do much more on the administrative side than seeing patients. And so that's a big burden on, and so that's why by necessity, you're seeing that they're having to form small group practices or large group practices or accountable care organizations just to make it, to make ends meet. And that's a trend across the United States.
Dennis, you have a question?
Yeah, more for Lisa. Has the hospital, or any of the hospitals across the state, considered building physician and nursing housing? It used to be a trend right back in the day where the hospitals would have dormitories or some type of housing for these healthcare providers, but that's kind of changed now. And I remember a few years back, the hospital actually had a house for those rotating physicians to stay in.
I still have the house.
Yeah. So
yeah.
Are we expanding that concept? And what can we do as a business community to help support that effort?
Housing is huge. So I actually spend a lot of time working with the recruiters at the hospital and sometimes in the community to help find housing for new providers that have come in. And then we had the house on the hospital campus that was the former administrator's house where we house all the students that come on rotation. We created this robust role pipeline, which is fabulous. And so then we had to rent a house off campus. And the foundation just purchased a house on Lakapu Street that's 4,013 square feet. Because with all the growth on the hospital campus, we're losing that house. So we're in the process of renovating it and looking for funding to help us to pay for the house. So yeah, we have that house in Hilo, 8 bedrooms, 4,013 square feet. We can have 16 people-ish there at one time. but that's still sort of capping our capacity. And then that doesn't help when we have providers. And I just had all of the, it's called AHEC, Area Health Education Center, and that's recruiting students into health careers. And it's across the Hawaii Pacific Basin. It's federal monies. It goes to the John A. Burns School of Medicine as the main grantee, and then we're the sub-grantee for Hawaii Island. We just had all of the AHEC directors from the Pacific Basin here yesterday seeing what we do and how we do it. And what they would love to do, the main program office, is, I mean, we really should own our own house on the Kona side. We rent one, we have a good price on the rental right now, but we need one North Hawaii. We need one on all the neighbor islands. So working with the business community or with Rotaries and service programs to help with the maintenance of the house, you know, because Hawaii, you know, it's a harsh tropical environment. It takes a lot of maintenance to maintain the houses, but to be able to have that housing is critical to these pipelines, and expanding the seats at the medical school as well. Right. So being able to train students on island for their first 2 years, and then they can go off and do their clinical rotations, is one of the things that we're looking to do on all the neighbor islands. So yes, Dennis, we could use your help.
You had brought up the surgery center, and I know that there was kind of a cry out from the physicians there that they were talking about having to close that. Do we know where that is at this point?
Andy?
Yeah, I do know that there is discussion and possible solutions for a path forward for the surgery center, so that it can remain a asset to the community, and that it would be available for all of the independent doctors to use as well. But I'm not at liberty to disclose anything yet. It's still in like a discussion phase though. So keep our fingers crossed that there could be a path forward.
Yeah, so I was remiss, but Randy's done an excellent job as the executive director of Community First in fostering these conversations and relationships to help keep resources in our community. So I wanted to thank Randy for that.
Thank you.
And so that's why I brought up the surgery center. So didn't mean to put you on the spot with it, but he's done fabulous work with that.
Great, thank you. Yeah, with a lack already, we don't need to be closing anything, that's for sure. You know, this is one of the things where, you know, I was asking about coming up with ideas of what we can talk to our elected officials about, and maybe this is one of the things we can talk to about. But because I was thinking, just, you know, even a couple of years ago, I think it was the state house tried to raise taxes on to the highest in the nation on anyone making over $200,000. And I'm thinking, so you say we have a shortage of physicians, and then you want to tax them the highest in the nation. How the hell does that make sense? Right. So it's just the kind of thing where it's like, luckily it didn't go through, but
Yeah, Think Tech Hawaii did a big thing on that. They had me and Dr. Loris Wade on one time talking about that tax. And then another time they interviewed me in regard to that. And Hawaii is the only state in the nation that taxes healthcare, FYI. And the general excise tax is not paid by the hospitals or the federally qualified health centers. That burden is placed solely on our small to medium-sized independent organizations and practices. It is actually illegal for healthcare organizations that are doing billings to pass on the general excise tax to their Medicare and Medicaid patients. Although tax says that you can. The Attorney General's office will take their license if they do so, if they find out that they're passing on that tax to Medicare patients.
So like, you know, like as a chamber, I think what we can do is perhaps just stay in the loop. And I think if we can collectively decide on, you know, 1 or 2 legislative, you know, agenda items that we can push and have, you know, one voice on as a community, I think then that might be the most, you know, effective way legislatively to help us on with healthcare.
Well, I'm certainly open to any ideas. And you talk about how there's a shortage of healthcare for Medicaid and Medicare. Well, there's still a shortage of healthcare for people who are regular insurance payers. I mean, I know when I moved back in 2007, we grew up with Dr. Irvine. So we said, okay, we need, and I didn't even care about me and my wife, but we were just asking for the kids. And they gave me 3 names. And I called all of them and they said, no, no, no. Gave me 3 more names and I called all of them and they said, no, no, no. And finally I called him back. He goes, okay, let me make a call. And that was the only way we got a doctor, was he had to personally call somebody to accept us.
Right.
So it's just crazy. So.
And that's still the case, and it's gotten worse. And so when we call around to ask, when they were given lists of providers that are accepting, they ask about your insurance, and then they ask about certain medications, and then, you know, that's basically the end of it, right? They're not taking any new clients. They're at capacity or over capacity. So we say we have network adequacy, but who is it adequate for?
People who already have doctors, I guess.
I guess, but it's all based on who you know, right? So if a provider knows you or you know somebody, then you can call and you could make it happen, but that's not how it should be, right? So we have, you know, many people moving here from the mainland because they can work remotely now and they don't have access to health insurance. So.
At least that's so true. I remember when I ran American Lung Association, I used to get the calls about the VOG, and people were moving to Kurohara and they wanted to know how bad is the VOG, like 2008 when Hale Ma'o was going off. And I said, you know, you're fine for the VOG in that area, but you might want to find out if you can have access to healthcare. And it's really who you know. Kevin Kurohara became my doctor because I ran asthma camp and he helped at it. And I'm like, oh, will you take me as a patient? Because we were out, our provider was leaving. So, you know, we've heard those stories, like you said, for 20 years.
Yeah.
All right. Well, thank you guys very much. This has been very eye-opening and excellent information, and anything we can do to help further it, certainly open to doing that. I would ask that all of you try to think about, you know, what can we do to move this business community forward, and that includes physicians, and there's lots of different groups that we need to, and maybe you can either shoot me an email or you can shoot it to Taylor and she can pass it on. And I was remiss in letting Taylor introduce herself, but we all know Taylor because she's the acting executive director this time. So good job, Taylor. So yeah, so that basically that's my ask of you. And if there's anything that you want me to be doing or people you'd like to hear from, please send me that information as well. Any other last minute questions or anything you guys want me to be doing?
Thank you for doing what you're doing.
Well, yeah, you kind of get, just like everybody else, you get your arm twisted and you go, okay, all right, I'll do it. Okay. Okay, well, fantastic. Thank you guys again so much for providing this information. It's great. You said you were going to send something to us about another meeting coming up?
Yes.
Okay.
Go ahead, Kim.
Yeah, so we have our webinar for our main presentation coming up on the 26th. I sent that over to Taylor. She'll be distributing that to the committee.
Okay.
Thank you.
Fantastic. I greatly appreciate it. All right. Well, it's just
Thank
about
you,
1
everybody.
o'clock. So we will, I guess, reconvene second Thursday at noon. So I guess when was that going to be, Taylor? August 11th?
Yes,
At 12
that's
o'clock
correct.
would be our next meeting. And we'll try to figure out before then what we want to talk about or who we'd like to hear from. So thank you guys all very much for coming, and thank you for hosting us, Taylor.
Thank
you.
you. Bye, everybody.
Bye.
Take care.
Thanks, Taylor.